So the debate today was whether low salt diet is good or not good for patients with heart failure. I was on the side that low salt diet is not good for patients with heart failure, which is a more unpopular approach. There are a lot of data that suggests that low salt diet is associated with lowering of blood pressure, lowering of cardiovascular risk, and all that sound pretty good, except that the physiology in patients with heart failure is different than physiology in normal people. Patients with heart failure have lower cardiac output to begin with, have neurohormonal activation to begin with, and when you reduce the salt significantly, you actually activate the neurohormones, you worsen the renal function, and you can worsen the hemodynamics as well. So based on these things, there are some data that suggests that strict salt restriction in heart failure patients specifically may lead to actually worse outcomes. So the issue here is that whenever you debate that low salt diet may be bad for heart failure, what I am not saying is that high salt diet is good, and that's the debate. So we know that most of the patients with heart failure take more than 3.54 grams of salt intake a day, and that is too much. This whole debate came across being because the American Heart Association came up with a recommendation for general population that, as opposed to the classic recommendation of 2,300 milligrams of salt, that it should cut down to 1,500 milligrams. And we feel that 1,500 milligram may be too low for patients with heart failure. So the debate is whether you should be somewhere between 2 to 3 grams or you should go really less than 1,500 milligrams. But nobody is saying that you should be taking 6 grams. So the argument on the other side is that if low salt is bad for average person, then low salt probably is bad for patients with heart failure. And there are clearly observational studies that suggest, if you take large databases, non-randomized, non-controlled for, that patients who take low sodium do better with heart failure than those that take higher sodium, and they have worse outcomes. The take-home message is not that high sodium is good, and then we need to keep that in mind. And the question is, some of these patients are on low potassium diet and low sodium diet, and because of the coronary artery diseases, they are on low fat diet. I mean, it becomes very, very difficult. And the question is that a person who's doing okay, who's not significantly fluid overloaded, maintaining their weight, their symptoms are stable, that maybe no added salt and avoiding high salt food is just good enough, but not get too strict about trying to control the salt. On the other hand, if somebody is not doing well, is really congested, fluid overloaded, you're having trouble making them feel better, and those patients, maybe restricting salt more strictly is perhaps the right thing to do, but not necessarily for everybody. In the overall population, there is enough evidence to suggest that lower salt intake is good. But if you'll take the overall population of heart failure, I really cannot answer that question, because remember, all of these data that suggest that things get worse or things get better is predominantly in patients with heart failure and reduced ejection fraction, which is 50% of the population. The other 50% of the population, we actually have severe lack of data and we don't know. And there's a lot of subtleties here. When you say 2,300 milligrams or 1,500, remember, I'm a big person, so I eat more calories. And if you have an 80-year-old lady who weighs 110 pounds and who's half my size, what does 2,300 mean for her versus me? So there's a lot of things that go into it. The stance that I'm trying to take is that we just cannot sort of make up things. We need to study them and then try to inform the best decision. And because of the importance of diet and nutrition and sodium, which is all over the place, this is not a rare issue for few patients. This is a common issue for all patients, and therefore it needs to be studied further. Absolutely. So there is no reason to believe that if you're on good medical therapy, that very high or very low salt intake is immaterial. There's no reason to believe this is in addition to the other things that you're doing. Right now, what the guidelines say is that it is reasonable to restrict salt in patients who are symptomatic with heart failure. Now, obviously, this leaves open to interpretation. How much symptoms is symptomatic? What does reasonable mean? Is it less than 3 gram, less than 2 gram? But the way the statement is crafted actually does come from the fact that we don't have objective data. I don't think so. I mean, again, data rules, and at the end of the day, we need to have science. But I think the data are clearer in patients with, for instance, hypertension, that low salt diet reduces blood pressure and reduces the risk of further cardiovascular outcomes. So my comments are really restricted to patients with symptomatic heart failure.